Hi, my darlings, and welcome back to my YouTube channel. I am pharmacist Charity Amaka. Sometimes our body could be trying to show us some certain signs of infertility, but we often neglect that, maybe because we are not aware, and this can lead to so many challenges in the future. And infertility is not something to be joked with at all. Infertility can be so challenging, and it's not something to be joked with. And this infertility affects millions of people in the world. In fact, about 1 in 8 couples experience infertility at some point in their lives. So catching the signs very early could change everything and bring you a step closer to the family you dream of. So in this video, we will explore the early signs of infertility together and what you should do if you notice these signs. But before we start, let's even understand what infertility means. Because some people think that they're infertile, meanwhile they are not. Infertility simply means the inability to conceive a child after 12 months of regular unprotected sex. So that regular is key in this my definition, because you should have tried regularly, consistently, for minimum of 12 months. And if you're not getting results, that is when you can now state that you're experiencing infertility. Now, there are some misconceptions about infertility that I would like to clear today. And the first one is that infertility is primarily a female issue. That is wrong. Infertility affects both men and women almost equally, which makes it crucial that the both partners should be evaluated. The both partners should go for evaluation if they are experiencing difficulties conceiving. It shouldn't just be a women thing. Now, the other misconception is that infertility affects only people of older age. That's not true. Even though age plays a key role in infertility, especially in women who are older than 35 years, infertility also affects couples of younger age. So it is not just age-related, it can affect people of any reproductive age. Now, I also want to make a point, and that point is that in some cases, the cause of infertility may just be unexplained. Even after thorough medical evaluation, there won't just be any explanation for the cause of the infertility. So in cases like this, the couple will just have to keep trying, give it time, and with time, it resolves on its own. Now, disclaimer, this video is for informational and educational purposes only, and not a substitute for professional medical advice. We all know that I am a pharmacist. I am not a fertility specialist. So, the things I'll be saying in this video are things I gathered from research. So, it's not supposed to be used as a substitute for professional medical advice. Now, let's move into the business of the day. Early signs of infertility in women. We'll be focusing more on the women today. The first sign is irregular menstrual cycle. If your menstrual cycle is irregular, that is, your menstrual cycle doesn't fall within the healthy menstrual cycle range of 21 days to 35 days every month, or you are having infrequent periods, maybe some months you see your periods, some months you will not see your periods, or you are not even seeing your periods at all, we are experiencing lack of periods, and not seeing the periods at all, then you could be at risk of infertility. And these menstrual disorders can be symptoms of infertility due to PCOS, that is polycystic ovarian syndrome, and uterine fibroids. So all these things will now contribute to making your period irregular, putting you at risk of infertility. So irregular periods is one of the signs of infertility. Now, the second sign is heavy or painful periods. If you're experiencing very heavy or painful periods, then you might be at risk of infertility. I know that some women experience painful periods normally, even me, I experience painful periods. What we are talking about is when the pain is so severe that it becomes unbearable for you. Sometimes even taking all this pain relievers will not even help. So if you're experiencing such kind of severe period pain, then it can be a sign, an early sign of infertility. And also, if you're experiencing very heavy periods that you might need to be changing pads every 1 to 2 hours, or you even bleed more than a week, or you are passing very large blood clots, then you might be at risk of infertility. And these heavy and painful periods can be due to what we call endometriosis or uterine fibroids as well. So when you're experiencing very heavy and painful menstrual period, it could be a warning sign of infertility. The third sign of infertility in women is hormonal changes, hormonal imbalance. We know that hormones are prominent in fertility, and female hormones like the progesterone, estrogen, luteinizing hormone, and stork they all work together to bring about ovulation and also to guide your body throughout this entire menstrual cycle. So if there is any slight imbalance in these hormones, then it can throw everything off, and then you get at risk of infertility. So how do you know if you're experiencing hormonal imbalance? Some signs of hormonal imbalance include 1. Acne. If there are so much breakouts of acne on your face, it can be a sign of hormonal imbalance. Another sign of hormonal imbalance is severe mood swings. If you're experiencing severe mood swings, then hormonal imbalance might actually be the cause of that. Then the other sign is unexplained weight gain. If you try so hard to maintain your weight, but you just keep adding weight, and you can't explain the reason behind that, hormonal imbalance could cause that as well. And the other sign is an excess body and facial hair. If you're experiencing an excess facial hair around your face, your jaw, your chest, etc., that could also be caused by hormonal imbalance. Now, another sign is hair loss. Yes, your hair will just be cutting. I can't explain the reason behind that. It could also be a sign of hormonal imbalance. And we also have a low libido, that is low sex drive. If you are just not always in the mood, you just don't feel like having sex anytime, then that could also be a sign of hormonal imbalance. We also have vaginal dryness. If you experience vaginal dryness, painting, then that could also be a sign of hormonal imbalance. And this hormonal imbalance can actually make it difficult for you to conceive. So you can just go for a hormonal profiling test to figure out the hormones that are not balanced and then start taking medications to balance that. The fourth sign of infertility in women is pain during sexual intercourse. If you experience pain during sexual intercourse, this could be a sign, and this pain during sexual intercourse could be caused by either fibroids, endometriosis, or even pelvic inflammatory disease. Now, the fifth sign of infertility in women is milky white discharge from your nipple. So if you're experiencing nipple discharge and you're not breastfeeding, you're not nursing a baby, but you keep having nipple discharge, this could also be a sign of infertility, and this can be caused by high prolactin in your body. Now, what are you supposed to do if you notice these signs? Before we continue, have you liked this video? Have you liked this video? If you feel that you are getting value from this video, please like this video. Thank you. So back to what we're saying. What are you supposed to do if you notice these signs? The first thing you need to do is to seek urgent medical attention. You have to go to the hospital to see a doctor or a fertility specialist so that you'll be examined and they will find out the things that are responsible for all these signs and symptoms that you're experiencing, and then you will now start receiving treatments early enough. Now, the other thing you also need to do if you experienced these kinds is lifestyle changes. Yes, you have to make some adjustments in your lifestyle, like one, eating healthy. You have to ensure that you're eating healthy, that you are not overweight or underweight, because weight actually plays a key role in fertility. So you have to adjust your meal, your meal plan in such a way that you're eating right. You're not overweight, you're not underweight. And the other thing you also need to do is to reduce stress. If you are stressing yourself so much, you have to find a way to cut down on stress, because stress actually plays a key role in infertility. And you also have to start taking enough rest, sleep well. Sleep well. Try to improve your sleep quality. This will help you a lot. And also, smoking cessation, if you are the type that smokes, is not there for you. Smoking actually affects fertility. Now, even alcohol consumption, you should also avoid or reduce your alcohol consumption. It will also help you a lot. The other thing you can also do is to start taking fertility supplements. There are some good fertility supplements that you can start taking that will actually help your body a lot, that will help your body system to normalize and all. So I will try and make a video on some of the essential fertility supplements that you can start taking that will help you in your fertility journey. Remember that early detection is key. So if you have any concerns, do not hesitate to reach out to your healthcare professionals. And if you have any questions or any topics you would like us to cover, drop it on the comment section. And do not forget to subscribe to this channel for more content like this. Thank you so much. Stay healthy, stay informed, and I'll see you in the next one. Bye.